The nationwide legal battle against the administration's new health care overhaul won a major battle yesterday. A federal judge cleared the way for a big challenge to move forward that says the mandate requiring most Americans to carry health insurance may be unconstitutional.
Now, could the ruling force states to rethink if they will comply with the new regulation? And if so, how could it affect your medical coverage? We're joined now by Dr. Sreedhar Potarazu. He joins us right now, President and CEO of Vital Spring Technologies. Dr. P, good to see you again.
Hey, Chris. Good to see you. How are you?
All right, because it doesn't seem like this particular ruling is getting as much attention as maybe I think it should. It seems like a little bit of a watershed event and might cause a domino effect.
It could. It's going to get more attention down the pike, Chris, because this is still not the final verdict, but it's a good indication that the judge has said, look, we really need to pause and look at this carefully because we're not sure whether the government is actually overstepping bounds in terms of how much it can regulate interstate commerce and all of the clauses in there. But for all the people watching today and for the average consumer out there, it really has some real implications because what the government is saying is everybody's got to buy health insurance. But the bigger picture here is suppose that the government went out and said everybody's got to go out and buy that car in the used car lot, and it doesn't have an engine or it doesn't have gas, but because everybody's got to have a car, you've got to go out and buy that. That's sort of the equivalent here because just because everybody out there has to buy coverage, it doesn't necessarily mean that you're going to have enough to go and see the doctor or get the things done that you need to. And so you're going to end up spending on something they may not necessarily do the job. And that's the bigger question here of can we force people to spend money on something that may not have tangible value?
But here's the thing, and this is the point of argument, so I'm curious for your response. The administration will say everyone's going to get sick. At some point in your life, you're going to need to see the doctor, go to the hospital. So all this legislation does is regulate how those doctors and hospitals are paid for their services.
Yeah, partly. But, you know, speaking from my other hat on, I'm not practicing medicine today, but I was for many years. It's not just about getting paid. It's about getting compensated to be able to take care of everybody and do everything that you need to for them. I mean, that's sort of the challenge here is trying to make sure that you're not having to cut back or ration the kinds of things that you have to do for people because either you have too many patients to see or there isn't enough to go around. And so the government is hoping that by everybody having coverage, that's going to be a proxy for getting care. And the two don't really tally up. And that's a really important point that just because you have coverage doesn't mean that your doctor's going to be able to do everything for you when you need it.
It's an interesting discussion, that's for sure. In reading about you, Dr. P, I understand you consulted for companies like McDonald's, Kodak, and Microsoft on these issues. We know McDonald's, right, made headlines because they were unsure they could even cover their employees' medical costs under this new legislation. Did you advise on that?
I've been involved with them for years. And without speaking on behalf of them, obviously, I can tell you just from my observations of the industry as a whole and McDonald's and other companies, their biggest concern, especially around what are called those mini-med programs for those people in the franchise or who are working part-time, is that the insurance carriers can't afford to put in place a plan that keeps the right coverage in place. If they don't have insurance coverage, then they may not actually attract employees, so that these McDonald's employees may end up going to work for Walmart. So McDonald's and all these other companies are really concerned of how do we make sure that our employees still get coverage, and that was the pushback to HHS to say to do that. But the government wanted to sort of shut everything down and say, look, that's not the case, and we're going to try to make exceptions here. Who's going to decide on making the exceptions? It's sort of an arbitrary rule. How do you pick and choose who gets to bypass the law and who doesn't? And that's the bigger question here.
Dr. P, destined for the Supreme Court, no doubt about it. Thank you for your time.